Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh. This is me, Gurpreet Sandhu, and today we've got a very special show where we're providing you an insight into what many in the media have dubbed as the new Facebook for Health, Anoncare. Now, unfortunately, 1 in 4 people tend to develop mental health issues during the course of their lifetimes. 1 in 5 men and 1 in 7 women are likely to develop coronary heart disease, and 1 in 3 of us watching today are likely to develop cancer. And not only is it a challenge to find these diseases in time and diagnose them, but also once they've been diagnosed, many people are left in isolated states to tackle these illnesses alone. With the growth of Facebook and other social media platforms reaching over 1 billion users, now Jyotveer Gill, who's with us here today, has decided to try to use that technology to address the issues within health and fighting disease. So Jyotveer, if we were to start with a little more information about yourself.
Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh. It's a pleasure to be here today, Gurpreet. About myself, I'm a communications specialist with some years' experience working in the NHS. I'm currently based in Bournemouth, and my role really is to empower patients with the right information so they themselves can make informed, educated decisions about the appropriate use of services. As you mentioned, we're living in a challenging environment, and there's often barriers that restrict accessibility to information. These can be geographical, cultural, even physical barriers. And we recently heard in the media that the Prime Minister announced there's a greater need to raise awareness of HIV and AIDS. I think there's about over 25,000 people in the UK who live with the virus and don't even know about it. So patient and public health education really is a priority right now. And I see my role in addressing these challenges by creating solutions like the Anoncare system.
Many in the media have talked about Anoncare being the next big thing. They've said that it's the new Facebook for health. And I just want to understand, I mean, how does it actually help?
Just to give you a bit of a background, Gurpreet, social networks are hugely popular. Yep. Facebook has over 900 million active users, and we recently heard that the Pope has joined Twitter to communicate with his followers. So we know that social networks are both powerful and popular for interacting with one another. And in my experience working in the NHS, I've seen a lot of NHS organisations embrace Facebook to communicate with patients, and they've not always been successful. And this is from my experience, from what I have seen, for a number of reasons, like patient confidentiality. If I am living with cancer, I may not want to follow cancer services on Facebook because I may not want my friends and family to know about my condition. And because it's a private thing, and you may not want to share this with other people, and Facebook is quite a social platform. So also it's a conflicting environment. You get health promoting and demoting material at the same time. It's not rare to see a advertisement or a campaign from the NHS about obesity awareness, and then to flip the page and see a McDonald's, a McDonald's advert. So it's a challenging environment. So and it gave me an opportunity to develop a unique a system dedicated to patient care, where patients can sign up for free. They can sign up anonymously and join groups, communities, chat rooms dedicated to different diseases and conditions, and also meet like-minded patients following similar patient journeys. It also allows patients, their carers, their friends and families to find out more about different conditions, watch clinical films, play interactive educational games, and take part, and also take advantage of a private journal within the system where they can input information about their health and well-being, and then share it with loved ones. So it's a very exciting system. But one thing that's really separates it from other health systems is that the fact that the healthcare providers, doctors, consultants, organizations, health organizations actually publish the material on the platform. Therefore, you know the information is credible, you're not receiving any mixed messages, and for the patients involved, there's transparency and choice.
That's fantastic. It's ongoing care and support.
Yes, it is.
It's exactly what you need to try to overcome a healthcare challenge. I mean, but you know what's interesting for me is this is a unique initiative. You know, people are talking about it as the Facebook for Health, and you're the innovator that's brought this to the fore. I mean, tell me, how did you come about developing this system?
Well, originally, Gurpreet, my idea was to develop a platform, a website where patients could interact with their healthcare provider, the doctor, the consultant, the health services, and also find out the latest information about their condition or disease.
Sure.
And I approached the chairman of Guru Nanak Nishkam Sevak Jatha, Dr. Paisa Bhai Mohinder Singh Ji, who really guided me to develop more than a public health system, but a system that empowers people with values, also empowering people with information, but values for the common good, for the greater good, values for Sarbat Apala. Bhai Sahib Ji inspired me with the notion that we are all social beings, and though we all individually aim to live healthier lives, this is not it's not possible without social action for the common good for others. So helping others to be better and live better. And this is exactly what Anoncare is about. We want to empower people with values, values of compassion, empathy, selflessness, ever-ascending optimism, and love for others on the platform. And we're really asking people to join the platform, sign up to the system, and extend their support to others on the platform who as a result of a health condition may be feeling helpless, lonely, or in need of support. And sometimes only what patients want to hear is from someone is, I understand, I'm there for you.
Absolutely.
So the platform really is, I see, as a exciting merger of the latest in technology and age-old shared values for Sarbat Apala.
And if I was just to add to that and reflect on a story with you, recently I had the opportunity to sit with a person of faith, and what they had said to me, this is someone from a different faith tradition, and what they had said to me is that when we talk about the Sikh concept of seva, often that was seen as something that you do in the Gurdwara. But Sikhs, more and more so globally, and we're being recognised for this, are starting to conduct seva in new and innovative ways and outside the Gurdwara, right?
Yeah.
I mean, is this a form of seva as well?
We are inspired by our faith to Varnashako, to share with others. And sharing with others could be sharing part of our income, sharing our knowledge, and also sharing our experience.
Absolutely.
And I think seva, there's an element of seva which should be selfless as well, for the greater good of another being. And what Anoncare really is, I believe, is a human response to the suffering of others. It allows people to give of themselves to elevate another person.
That's fantastic. And so what's been the impact of the system so far?
Well, we've just launched, and there's a lot of healthcare providers that are signing up to the platform right now.
So that's doctors, nurses?
Yeah, we have so many consultants on the platform.
Fantastic.
Birmingham Mind, a mental health support group, has recently joined the platform as well to help support patients. But what's really interesting is the interactivity on the platform that we have seen. Just last week, we had a lady sign up from Dorset who actually signed up to the system to ask for support for her bipolar condition. And immediately we saw someone sign up from Manchester, somebody, Benji, also signed up from Birmingham to offer experience and advice that they had with that particular condition. And more recently, we've had a new member sign up to the platform, the bipolar bandit from North Carolina, USA.
Oh, fantastic. Okay.
Yeah. And so we've got a member from the USA helping somebody in Dorset, which is really moving. But what it really demonstrates, Gurpreet, is that I think it shows that compassion, daya, is a key element of helping people feel better. It's part of patient care. In fact, compassion in its original comes from a Latin word, which when translated in its original form means to bear or to suffer with. And when you suffer with someone, you go beyond your self-interest to elevate them into a more optimistic state. And Mother Teresa often referred to this as love in action. And I think love in action is what we have been seeing on the Anoncare system.
It's amazing, and it's interesting that earlier on we'd mentioned that there isn't a credible source, a single credible source when it comes to healthcare needs on the internet, And actually there is a gap in the market, and there's a gap not only in terms of technical competence and there being one place where you can go and you can get information and support, but also a gap in terms of values.
Yes.
And I think actually you're infusing both the technology, but you're infusing it with a sense of values and a Sikh ethos. And that's fantastic to see. I mean, how do people actually sign up to this?
Well, they can sign up to this faith-inspired, innovative system at www.anoncare.com. It's free, and if you're a healthcare provider and you wish to contribute information, resource, and start your own care community, invite your patients onto the platform, then please do get in touch with me, and so I can actually create you a care provider account. And my contact is j.gill@anoncare.com.
Oh, fantastic, fantastic. And you know, if I was to ask you, I mean, so what are some of your plans for the future?
Well, we recognise we're living in a global village, and sometimes local solutions can be applied to national, even international challenges. You can see that the system was actually made for people in the UK, and we're having people internationally sign up straight away to help one another. So, but I think it needs action, personal action for the wider benefit of others. And I would really ask members of the Sangat to sign up to the platform and help others. Also use the system to get more value for yourself, but also provide value for others by supporting them.
You know, that's a great point. I think, you know, for everyone at home, it's this, like anything, is only as successful as we make it. And somebody from the community has stepped forward and tried to really operationalize a lot of the things that we talk about in our faith, you know, to take some of those values and put them in a form, create a solution that actually tries to address a real challenge. I mean, health in this country, if we think about some of the challenges, I mean, 1 in 4 people are likely, as we've mentioned, to develop mental illness during the course of their lives. 1 in 5 men and 1 in 7 women are likely to develop coronary heart disease, and 1 in 3 are likely to develop cancer. So it is a serious issue, and unfortunately there isn't much in terms of long-term support that is offered currently. And Jyotveer Singh with Anoncare is trying to enable people to be able to not only access healthcare professionals such as doctors, nurses, other care providers, but also start to network and start to use a support network of other people that are suffering similar challenges, or other people that would like to volunteer time to try to help others who are in a situation or healthcare challenge that they're currently facing. The system will also have videos and information that you can trust in chat rooms, but most importantly, it's confidential and you can join anonymously. So if you're suffering from a healthcare challenge, please do visit www.anoncare.com, that's ANONCARE.com, one word, and join up. And I think, you know, I'd leave you with a final thought. Seva is often seen as something we do in the Gurdwara, but the reality is that Seva can be done in a multiplicity of ways. You can do Seva from home, and this is another avenue for you to go out there and try to serve others, whether that's anonymously or otherwise. Please do visit www.anoncare.com. So thank you so much for joining us today, and Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh.